May I call you Deane? Is that
Certainly.
okay? All right. My questions get edited out of the tape that we're creating here, and the tape will be used by CDC, the National Library of Medicine, possibly the NOVA series. We are representing them as we come down here for this. We don't know precisely how it will get used, but it's kind of a historical record of, you know, the smallpox eradication effort in Africa, and we're going to be creating transcripts that will also be available to researchers to try to piece this history together, and who knows, maybe some case studies for medical people today who are in training to learn, you know, how it was done and so on. My questions get edited out, so as much as possible, if you can make your answers be a full thought, rather than just a fragment in
rather than yes and no.
Exactly, right. Yes, so if you want, you can incorporate a little piece of my question in your answer. If that's easy to do, that's fine, or put it in your own words. And prepare for these, but I didn't have time to carefully study everyone's background and participation, so we'll do the best we can.
Camera's rolling.
All right. I wanted to ask at the beginning, I noticed that you were in private practice in Booth Bay Harbor and then teaching at the University of Maine. I'm sorry, yes. What is your name, please?
I'm Deane Hutchins, and I release the information to you at my own free will.
Thank you so much. I noted in reading your bio that you were involved in private practice in Booth Bay Harbor and then teaching at the University of Maine. So how did you even begin to think about taking a leave of absence to join the Smallpox Eradication Program? How did that all come about? Hold on one second until Bob's okay.
Yeah, while at the University of Maine, I was the Director of Clinical Services at the Student Health Center. And I saw some, what I thought was some influenza. I knew D.A. Henderson because he was my classmate in medical school. And I knew he'd been on the surveillance program for the influenza. So I called him up and said, D.A., are you interested in some throat washings of influenza? And D.A. said, no, not really. He said, but would you like to go to Africa? My wife and I had never talked about this. Went home that noon and talked with my wife, and I'd said I'd seen D.A. She said, what did you talk about? And I said, nothing particular. He asked me if I wanted to go to Africa, and she said, what you tell him? As I say, we'd never talked about this. And I said, nothing. My daughter, who was here with us today, was home from school, and she went to school and told her teacher was going to Africa. Within 2 days, I'd called D.A. back and said, yes, we'd like to go. Got a leave of absence from the university, which was for 2 years. Now, universities don't like to give a 2-year release, but the president of the university had been overseas himself and knew that it's a 2-year assignment. So I got a 2-year leave of absence, and we made up our mind, and in July we came down to CDC and was on our way.
I noted that you'd had a major in zoology in your earlier years.
Yeah, that was from zoology. It was just a part of the pre-medical course that we took out.
And why do you think DA tapped you to do this, and had you ever imagined that you would be working abroad in public health?
No. There's a first thought about public health in many respects. I'd done a little bit of surveys at the university, you know, when they had the usual food outbreaks, and tracked that down, but nothing really formal about epidemiology. DA, as I say, I worked with him. Matter of fact, he was in the same room at a dissecting table in medical school I was at, so I knew DA well.
Okay, and had you ever imagined that you would work abroad?
Not in particular. I'd been overseas during World War II, but nothing beyond that.
Okay. Okay, so you can blame all of this on DA.
Blame it on the DA.
Okay, all right. Well, and tell me a little bit about your family at the time. Were they excited about this? Were they, and was there just the one daughter? Remember, your answer has to stand alone because nobody hears my question.
Yeah.
So.
We'd never considered going overseas. My wife, though, was excited about it. All 4 daughters was excited about it. And had there been one dissent, I'm sure we'd have thought, well, we shouldn't do it. But we decided to go and never had regretted it at all.
Would you call your family adventurous and outgoing and curious?
I guess the family probably was curious and was moderately outgoing, and they had a good time.
Okay, and how old? What was the range of your daughter's age at this point?
The oldest one was 14, I think. My oldest daughter was 14. The youngest was probably 7.
Yeah. So we can go now?
Camera's rolling.
Okay, great. So tell me what happened after that phone call from, start with the phone call from D.A. Henderson, and then tell me what happened then, and get yourself and your family to Africa.
Well, we started preparing to go to Africa, and come June, we packed up a Volkswagen, packed up a car and drove to Atlanta. If you wanted some of the humorous things, we sent a Volkswagen bus in June to Nigeria, and we received it the next February, which was sort of par for the course.
And so did you send, you can bring that in and put it down, thank you. It'll be right there by your,
Okay.
if you need it. Did you need to send an enormous boatload of goods?
Yeah, everyone, read all the things you should take when you go overseas, so a lot of things we took.
One second, because there's a noise that, it's just a passing truck, excuse me, it'll ruin your sound, so we'll start again in just a second. It's only the second one we've heard today, so we shouldn't have that too often. It's retreating?
It's a train.
Oh, it's a train. Huh. I thought it was
There's a track spur that goes right behind it.
Oh, I see.
It's not.
Well, I'll take a drink.
That's a good time to do that.
I'm stuck.
All right. No. You okay, Bob, do you think?
Camera's rolling.
Yeah, okay. So you sent a large...
Well, we had 2 shipments. We had an air shipment, limited pounds, and then had a sea freight, which was take most anything you wanted. And, you read books to find out what you should take. Air freight got there just before Christmas. We left in, I think it was October. Sea freight didn't get there until sometime in the spring.
Okay, and so was it a pretty big culture shock for you and your family? And talk to me about the language issues and some of the cultural changes that they had to get
The culture shock hit us, I think, the worst right in Lagos, which is the capital city. And from the airport into the center of the city, it's pretty raw. The smells are terrible, as you may well remember. It wasn't unusual to see a dead body on the street, and it would stay there for a day or 2. The language, most of the people we dealt with could speak English, so that wasn't a big problem. When we get up to Kaduna in northern Nigeria, we did try to pick up the local language, which was Hausa. Enough so you could, say good morning, how are you, where's the bathroom, how do I get home, what time is it, and that type of thing.
Okay, and would you say that you were welcomed by the local people?
Definitely. The local people use us very nicely. Never felt uncomfortable. And this was right after the Biafran War had started. Well, no, before the Biafran War started. But about 2 weeks before we went up into Kaduna, they'd killed about 30,000 Igbo people who were living up there. So you'd go by these houses that were strictly empty and burned out, and we didn't realize the significance of it at the time, but in retrospect, it was a little bit scary.
Now, how did you and your wife feel about this once you got there and you realized kind of what you had brought your family into? Was it something that...
It was an adventure. I don't think we ever felt uncomfortable. There were problems like communications, you know. We were there for 2 years. And to call the United States, you had to book it ahead of time. Then they would call London. London would call New York. Then New York would call wherever he was calling. One time I did get through on the telephone, and you was limited to 3 minutes. But my 3 minutes were used up by the time they got through, and I could just barely hear my father say, "Hello." And then the operator said, "Your time is up." And I said, "Would you at least tell them that we're all right?" And that was quite an experience. We had a telephone in our house all the time we was there. It worked just 3 months. And then the military government took over, and we lived right beside the military governor. And I know our telephone was given to the military governor. But that wasn't too bad because no one else had telephones either, so you couldn't call anybody.
So did your family feel isolated at all, do you think? Or
I don't think they felt isolated. Schools, all 4 of my daughters went to school in Kaduna. Then second semester, my oldest daughter went to an international school down to Ibadan. The problem there was that there was just one bridge across the river, and this was after fighting had started. And if it had blown that bridge, you know, it had been difficult to get to my daughter. They had 2 others that went to a missionary school in Jos, which is an American school, excellent school. But again, the problem there was during the rainy season, you couldn't drive. So it was a mixed problem.
transport, yeah. And what was your exact role on the Smallpox Eradication Program? Can you...
Yeah, I was the medical officer of the northern region. Then we had 2 operations officers that worked with us.
So on a day-to-day basis, describe for me the range of challenges that you would, and just your activities.
Well, let me tell you a little bit about our office. We lived in a ex-minister of finance house. This is a Muslim country, 90% Muslims. So they had the places for their wives. They had a long tunnel that went from the house out to the wives' quarters. There were 7 apartments out there, 4 for wives and 3 for the concubines. Well, since the minister had been kicked out of his house, the ministry gave it to us to live in. And we had our offices out in the old wives' quarters, which was very nice. Well, it wasn't very nice, but at least it was a place where we could sit down.
I thought you were going to say you installed your daughters in the
Well, I did have one district head come up to me and wanted to buy my daughter, but I told him she wasn't for sale. But he was serious, I think.
Right. Well, and on a day-to-day basis, what kinds of things were you involved in as an officer?
I was concerned about the quality of the vaccine, getting it there, getting it put onto a truck, taken out to the field. The reports of smallpox come in. We'd try to track those down, and we would visit the various smallpox hospitals. That's about it, I guess.
Was there a strong sense of collegiality among the people working on the effort?
Yes. Well, yeah, we had, I think it was, we had 3 groups of teams, and each team, I think, had 7 people to it. So we had well over 100 Nigerians that were taught to give smallpox vaccine. Now these are Nigerians that most of them had not gone beyond 7th grade, but they were classified as health workers of some level. But we would teach them how to give smallpox vaccine with the jet injector and how to take care of the vaccine. We stressed very strongly that the vaccine should be kept cold all times. We told the drivers of the trucks to turn his refrigerator off, because these are kerosene refrigerators, while moving along, and but when they got to the destination, that first thing they should do is turn it on. Well, I came across one truck one day, and it was probably 100 and so in the sun. He'd broken down, and so my first reaction was to put my hand down in the freezer to see if it was cold, and it was hot. And so I started giving him a bad time. But Master, he says, you said to turn it on when we got to my destination. And of course he was a long way from his destination.
So,
But you could tell stories like this for end on end.
and what was the, what do you think were the biggest obstacles that you faced, that you had to find a way around?
Communications is no question. I mean, for me to get in touch with my boss, Stan Foster, in Lagos was almost impossible. And to do it by courier, you know, it was a long time. There was another week or so before you get an answer back. But communication, by all means, is difficult. Transportation of the vaccine was difficult. Getting it from Lagos to Kaduna, they put it on a plane. And I remember one time, and we was having problems with this. So we had one of the Americans put it on the plane in Lagos, got to Kaduna, it was not there. Unbelievable. To this day, I don't know how much, where it was. And this was, you know, we're talking about several $1,000s worth of vaccine.
And when you were trying to work with, you were training the Nigerians, did you also learn things from them that,
Oh, yeah.
can
Yeah.
you elaborate on that, the two-way process?
I guess the overall biggest thing you learn from all developing countries is you're not going to change them a whole lot. They've been doing something one way, they're going to continue doing it about the same way. The first morning that we officially gave vaccine, I had a schedule all made out. At 8 o'clock, or at 7 o'clock, the drivers to be there. 8 o'clock, we'd move out. At 9 o'clock, we'd start vaccinating. Well, to begin with, the drivers didn't show up till after 9. And this was fairly typical of where you worked.
And were there sort of comical things that happened along the way, or?
Yeah, there's, well, thievery in developing countries is always a problem. We had these kerosene refrigerators, and kerosene was worth good money. So I went out one morning, and here's this fellow with a great 5-gallon can of kerosene in his hand. Oh, he says, I'm not stealing, I'm putting it back. I guess one of the funniest things that I remember of was Dr. Faggy. He had been in the eastern Nigeria, and then the Biafran War broke out, and so they asked him to leave. He came up in northern Nigeria, where I was, and he said he'd like to see some of my teams operating. So I gave him a truck and a driver, and he went out. About 3 o'clock in the afternoon, the Minister of Health called me and says, where is that Dr. Faggy? You know, he came up from the east, which, of course, is fighting. And I says, he's up country. And so they got the army out. They picked him up that evening. They wouldn't let him break his tent down. And under armed guard, brought him back to my house. Well, Dr. Faggy is a very tall person to put in the back of a Land Rover, especially with an armed guard on both sides of him. And to hear Bill tell the story, he says, I nudged one of these soldiers, says, would you mind moving that rifle over? It's hurting my leg.
You just hear him saying that.
Yeah, he's,
Oh, boy. Okay. I noticed, just moving aside from smallpox for a moment, that you were involved in tracing monkeypox to humans in 1970.
yeah, that was in Sierra Leone. Got a call that there was a case of smallpox found. Well, this was after smallpox had pretty much, well, we thought had been eradicated from Sierra Leone. So I went out in this village and finally found this case of smallpox. And clinically, it resembles smallpox. Clinically, you just can't tell the difference. So I took a brief history, checked see who had been vaccinated against smallpox, and this kid had not been vaccinated. Got some samples and sent them back to CDC. Again, communications 2 or 3 weeks later, got a cable back saying, this is smallpox, look for other cases. Because you can't have one case of smallpox without having another case. So I started looking. After a few days, got another cable from CDC saying, this is not smallpox, it's monkeypox. And if you grow it out on the allantoic membrane of chicken embryos, you can separate the two out. So I went back to the village again and took a better history. And sure enough, this fellow had skun out a monkey. There was a tribe that did eat monkeys. And he was the only one that had not been vaccinated against smallpox. And the rest of the village had been. And so there was good evidence that there was a smallpox vaccination also protected against smallpox. I mean, against monkeypox.
Can you tell me a little bit more about the experience in Sierra Leone? How did it differ from the experience in Nigeria?
Well, the day before we left the U.S. to go to Sierra Leone, WHO had reported cholera in West Africa for the first time. And so I called up CDC to get some information on it. I think I talked to Gene Gangarosa, one of the fellows in that group, and they gave me what information they had off the top of the head. Arrived at the airport in Freetown, and here the reporters were there saying, how were we going to eradicate cholera like we had eradicated smallpox? Of course, I didn't have any answers, and it's a different disease, and you can't eradicate it like that. That was so I spent most of my time with the cholera program that we developed while I was there.
And I'm wondering if there were things that you learned about public health in West Africa that you have been able to apply in your career going forward, either in some of these international places you worked or back in Maine.
Well, you look at if you see an outbreak of something, you take a different approach to it. Most practicing MDs aren't really interested in epidemiology, although you became interested in it once you'd seen how it can really help.
And if you had anything that you wish you could have done differently in the way the program was run, was there anything you learned that later became changed?
Well, getting back to the communications, because today it's so much different. And there wasn't too much that you could improve the communications in those days.
And how would you say that this experience had an impact on your wife and children?
Well, having lived with a different culture, especially a black culture, and my kids have no racial bias at all. I don't know if I mentioned this before, but my oldest daughter went to school with 500 Nigerian school girls. There was, I think there was 3 other expatriates in that school. My daughter has long blonde hair. The Nigerian girls were fascinated with this, and they'd come up and they'd feel up her hair like this. No, she learned a lot, and the other kids went to various and sundry schools, and my wife enjoyed it very much. And
So she wasn't one who said, "How dare you make a decision like that?"
well, we had a good time the first 2 years in Nigeria. Went back, swore we'd never go overseas again. Got back there about 3 months, and we decided, well, gee, we really had a good time. So we went back to Sierra Leone, and then after Sierra Leone, I went to the State Department, taking care of the American Embassy personnel, these other countries.
So it kind of turned you into adventurers for the rest of your life.
And my daughters, 2 of my daughters have lived overseas after they were married. And,
Did any of them go into health?
2 nurses, and one married a doctor. And,
So could you comment on the problems of health workers, and how you could see that getting solved today? I mean, from your experience, seeing the need for trained health personnel.
well, I think you've realized that you could train uneducated people to do a health program. For example, these vaccinators that we had very little education. Sterile technique was sort of unheard of, and we didn't really use much sterile technique. We did not clean off their arms before they was vaccinated. We told them if they dropped the nozzle of the injector on the ground, clean it off with some alcohol or something, they would just brush it off and put it back on. We did studies to see if there was any adverse effects, and there was no significant increase in infections from it.
And would you think that people can be trained who maybe haven't had advanced education to do many of the tasks of public health?
Yes, especially as something that's repetitive can be taught to most anyone. Matter of fact, there are places in West Africa now that they teach local people to do eye surgery. It's one simple procedure, but they do it, and they have very good success on it.
I've heard it said too that if one wanted to really solve the problem of maternal mortality, that if you could get some basic anesthesia capacity and some basic cesarean section capacity, you could do an awful lot in field hospitals to save women's lives.
Yeah, I think there are places where they've taught the local technician to do cesarean sections. It's not that difficult. Now, if they run into problems, well, that is a problem, and they probably can't solve it. But 9 out of 10 go along as you planned them.
Better than obstructed labor.
Yeah, sure.
Mm-hmm. Okay. Well, I've covered pretty much what I was hoping to cover. Is there anything I can ask you that you haven't had a chance to speak about that you would like to?
Well, it was a great experience. I would not recommend it to anyone if one member of the family didn't want to go overseas. As I say, I worked with the State Department medical program overseas afterwards, and I saw families that were sent over there and be one descending family, and that invariably that whole family was unhappy, and they either had to be shipped out or would quit.
But fortunately, you had a family full of adventurous people and curious people.
Yeah, our kids were great. My wife was great, and we had a good time.
Well, thank you so much. I really appreciate it.
Okay, well, thank you.